This is Brian Eastwood, site editor for SearchHealthIT.com. I'm joined by Don Falkinger, our features writer. Don covers many technologies in the healthcare space, including the rapidly growing mobile health market. Here we'll be discussing some of the key benefits and challenges associated with using smartphones and tablet PCs in a healthcare setting. This video is an introduction to a workshop on mobile computing healthcare strategies. The webcast and article that follow will build upon the topics that we discuss here. Thanks very much for joining me, Don.
Well, thanks for having me, Brian.
So first off, what specific smartphones and tablet PCs are most popular among physicians today?
Well, no doubt, hands down, the iPhone and iPad are dominant. Obviously, the iPad's pretty much the only one out right now. There are some competitors, but the iPad had such an early market lead that it's 99% or some fraction close. And on the smartphone side, we've heard that a third of all physicians in this country carry iPhones, and the ones that don't did not have iPhones because AT&T didn't cover their hospital or their home quite well, and so they, begrudgingly went to a BlackBerry, or Droid phones are also popular right now, but it seems like, from what we've heard anecdotally, that physicians are either carrying iPhones or they want to. And with Verizon now getting into the iPhone market, it could be an even bigger slice of the pie that Apple will hold with the iPhone.
So the iPhone is clearly dominant, but are there any devices that you see coming on the market that could challenge it or that will make a big play into the healthcare space?
It will be interesting to see how the Android phones catch up to the iPhones, because in the consumer market, the Android phones are catching up to the iPhone and in some places exceeding iPhone sales. So as software developers develop medical apps for both consumers and the clinical side of the hospital environment, the Android phones could catch up. And then also you have the BlackBerry and the associated Research in Motion Playbook, the tablet that goes with the BlackBerry phone. BlackBerries seem to be more popular among the business side of the hospital, the back office, the administrators, and so on and so forth. But if they integrate that playbook with the right medical apps, that could be a contender too down the road.
So speaking of medical apps, what are the sort of most appropriate clinical applications that are best suited for use on these mobile devices?
Well, for smartphones, the electronic medical record is to be able to port that to a physician's smartphone is a great thing. Then the physician, he or she, can. The classic anecdote we hear when interviewing medical authorities are, you can change a patient's prescription while at your kid's soccer game, and you can, answer simple questions that patients or nurses or other people who are involved in your patient's care, that come up when you're not in the office. Mm-hmm. And some physicians also like to work at home, and the smartphone is the most obvious thing to do that, and you can access all the patient data through the electronic medical record. And there are other things like sharing of lab results and porting other things to mobile devices like that. On the tablets, with the iPads and the Research in Motion Playbook, mm-hmm. and the Android devices, another very popular thing is imaging as well as reference books. So a physician might want to show a patient, a diagram of their knee or a hip that may be getting replaced. This is what your hip looks like, and here's a CAT scan we took, and this is what a normal hip looks like. And so mm-hmm. you can use those tablets to do demonstrations like that. It's much more patient-friendly than having a laptop and holding it up and saying, hey, look at this, and, didn't mean to hit you in the face with a keyboard, type of thing.
Or the x-ray that's always backwards that they have to sorry. Now, it seems like there's a lot of really good applications for it, but there's also, sounds like there's a lot of sensitive data that's being, displayed on these devices, and if a physician's working from home, being accessed outside of the hospital environment. So what kind of concerns do IT departments have when physicians, nurses, and other clinicians are using these mobile devices?
Well, that's interesting because, as you know, iOS as an operating system, as well as the Android operating system, it's designed for cell phones. It's very simple, and it's not as robust as a Windows or other operating system that IT directors have experienced, locking down security. So, and you don't want to lose any patient data. That's a serious breach of federal regulations. So if I'm a physician and I drop my cell phone and there's patient data on the cell phone, that's a breach. My employer could get in trouble for that. I could get in trouble for that. So that's the huge concern, and the answer seems to be web access for data that is not stored locally, as well as virtualization. So Citrix and other vendors have figured out how to port the Windows desktop or virtual machines to the tablet PCs, and in some cases the smartphones, or workarounds like that, double authentication and so on and so forth, to protect that patient data from falling into unauthorized hands.
Yeah. So with all these different tablet devices coming onto the market, each with sort of their own pros and cons, ultimately, what will it take for one particular device to dominate the tablet market in healthcare?
That's a fascinating question, because Apple, for all the good things it does with the iPad and taking over the market, it really doesn't cater to the business environment. Meaning, one CIO I talked to, he railed at me for not being able to buy more than one at a time iPad at the Apple Store. He said, I wanted to get 50 iPads. What did I have to do? I had to go to Target. So, and there's also questions about being able to keep them clean, which in an infection-controlled environment, you use some pretty strong solvents. And those are two questions that if Apple came out with a ruggedized healthcare iPad, I'm sure Apple would just take over, but they don't really seem interested in that. And so, and the Windows, the HP Slate, which runs Windows, is ruggedized, and so that takes care of one of the components of the problem. And Motorola Zoom, that tablet, well, Motorola has a lot of experience with ruggedized devices, other devices, their EDAs, that can take the abuse of these solvents that nurses must apply to it several times a shift, for infection control purposes. So the Motorola Zoom is very interesting, and the BlackBerry and its integration is interesting. And the iPad, of course, is the clear leader. That's the one that all the nurses and physicians want right now. But the big question that nobody's been able to answer, that I think is going to be a huge issue, is ergonomics. Yes. And OSHA steps in after injuries are reported. And if a nurse or a physician or somebody employed by a hospital gets hurt and they have to use an iPad and they think the iPad is the reason they got hurt or can prove it, then OSHA steps in and makes the employer take care of the ergonomic issue. So who is going to solve the tablet ergonomic issues that will happen? How will they do it, and who can solve it the most quickly? I think if you can answer that question, you can figure out which tablet is going to win out. Because just from my armchair view, as a reporter and not a CIO myself, it really looks like Apple is not trying to win healthcare. The company that tries to win healthcare, or the third-party vendor that can adapt the iPad to all the regulatory issues that come with healthcare work, that's who's going to win.
Nice. It sounds like it's going to be a very interesting few years for health IT professionals as they incorporate the mobile devices that their physicians and clinicians want to use. Thanks very much, Don, for providing your perspective.
Thanks for having me.
And thank you for joining us. We hope you found this informative.